Here's all kinds of places. We're loading the live broadcast as we speak. So I think we are officially going. People that have watched before know the drill. Give us a second to confirm that we are actually live and running. We are. So welcome back, everybody. It feels like I haven't seen you in a long time because there was an extra Monday in January, which means that we only do two Mondays a month. So it has actually been longer than normal since I've seen you. Plus, I've survived the ice planet Hoth since we last saw one another. And that 3 days kind of felt like 3 weeks all wrapped into one. So hopefully everyone's doing okay. Hopefully nobody had any major things here in Oklahoma City happen, like pipes freezing and all of those type things. If you're watching and you have no idea what I'm talking about, Oklahoma City got like 8 inches of snow last week. So you might be watching from sunny San Diego and have no context for that comment. So now you know. This is Parents Helping Parents Live. So let me go over a few things as we're kind of stepping into this. If you're not familiar with Parents Helping Parents, maybe you're seeing this video on YouTube, maybe you're seeing it because somebody on your friends list shared it on Facebook. Parents Helping Parents is a Oklahoma City-based nonprofit organization with the mission of connecting families with resources, education, and shared experiences for anyone who has a child any age, 1 to 100, who might be struggling with addiction or a substance use disorder. So most of our families have teenagers, 20s and 30s who are still struggling, but our goal is just to connect those families with the help that they might need. We are an organization founded by parents who have walked down that road, who have lived that, who knew the struggles of trying to find help and trying to find answers and not knowing where to turn. And so they just wanted to give back. So here we are. This live stream is one of the things that the organization does. We do this on the first and third Monday of every month. The bulk of what we do is we host live in-person support groups all across Oklahoma, Edmond, Norman, Tulsa, Oklahoma City, where parents actually get together and they get support. They have guest speakers come in, sometimes professionals, sometimes other parents, sometimes people in recovery, to share their story of hope or to share their resources. Our live stream is the opportunity to really reach people who are outside of the Oklahoma City metro area, other states, rural communities, and give them an opportunity to get some of the same messages. So I want to direct you to do a couple of things real quick. If you are watching live on Facebook, I want you to reach up and click the share button to share our video to your news feed. Even if you have 500 friends on your Facebook page, sharing this video could quite literally save somebody's life, because I guarantee you, out of those 500 friends, somebody on that list either has a family member or knows someone who's struggling with an alcohol or a drug related issue, or potentially a mental health related issue. And so we want to get the reach to as many people as possible. One way we can do that is just by you hitting the share button. Feel free as you're watching to comment on the Facebook feed if you have questions. In the title of this video on Facebook, we have a live text line going that I will also be monitoring. If you're worried about your anonymity or your privacy, use the private text line. That's not on the internet, right? If you put a comment on the Facebook video, that is there forever. So if you're worried about privacy, send me a text question. If not, comment on the Facebook feed. We'd love to make sure that we answer all of your questions. Okay. So Parents Helping Parents as an organization has no professional experience or expertise. We don't want to pretend like we're a substitute for professional counseling, professional medical advice, legal advice. All of those things we think are really important. And if you need them, we want to help connect you with people that do that. But as an organization, we don't have that experience or expertise. We get to bring in some people that have some experience and expertise in those areas, which is one of the things I'm excited about tonight. So tonight we have Brian and Aspen, who are two local clinicians that work in medication-assisted treatment, which is a topic that I understand can be at times a little dicey and has been in the history of recovery a little bit controversial, which is exactly why I think this is an important conversation. So we want to make sure that all of the families we work with have all of the information so that families and individuals who are struggling can make the best decisions regarding their treatment program and recovery as possible, because we want to help as many people as possible. So if you're watching this and maybe you've had some of those thoughts in the past about our topic, I would encourage you just to come to the table with an open mind, with the attitude of, hey, even though I've thought this in the past or I've heard this from other people, I'm here to learn. And I'm here to maybe pick up some new information that could be helpful. So with that being said, I'm going to turn it over to Aspen and Brian to talk to us for a little bit, and we can take questions as we go along. We've already had somebody comment that this is a great topic of conversation and they're excited. So thanks, Julie, for joining us. Or I guess it could be Jared, it could be your husband that's watching. So I will pass it over to you guys to get going, and enjoy.
Awesome. Well, thank you for having us on. Like Derek said, we work out of Right Way Medical here in Oklahoma City. We're at the South location, working in an opioid treatment program. So what we do is we provide another path to recovery. I think one of the biggest things and one of the biggest misconceptions in the world of recovery is that abstinence is king, and that just is not true. Some people do need to take a medication to help them in their journey, and there is nothing wrong with that. There's no shame in that. It's just like the person who might take heart medication to, control their illness and their disease. It's the same thing. This addiction, as we know, is not something that will eventually take your life if left untreated. And so we are here to provide another avenue for that. Just like any other outpatient treatment center, we do have licensed clinicians on staff. We have medical staff, we have a nursing staff, and this is for all the clinics around the country are regulated by not only the state, but the federal government as well. So the treatment that you're getting from any other outpatient facility is the exact same treatment that you're getting from our facility by people who are just as credentialed as anybody else. What we like to do here at Right Way is promote a environment of inclusiveness, because we do a lot of times people, when they come to us, they've tried everything else. So what methadone does is it is what we call a full agonist, and so it blocks the opioid receptors, so that if somebody were to use opioids, they would not get that intoxicated effect, and so it does help them to walk through their normal life, have a daily conversation, be able to go to work. It does not impair them in any way if they're at their therapeutic dose, and if used correctly. I think there's a lot of stigma out there associated with it. There's a lot of negativity out there associated with it because people only see the bad side. The people who are doing well and who are, moving along in their recovery don't really talk about what's going on. And they don't really talk about their use of medication because it's nobody else's, it's their personal life. So we're here to answer any questions that anybody has to, help their loved ones along in the journey and reduce the stigma associated with not only methadone, but addiction as a whole. So please, if you have any questions, put them in the chat box, like Derek said, ask them, and we're here to answer. What I'm going to do is I'm going to send it over to Aspen, and she's going to talk a little bit about pregnancy and methadone and buprenorphine and kind of how it works.
Hi, I'm Aspen. So at the clinic, I work with Brian as well, and with our patients, I work with the pregnant patients. A lot of times people will one, there's already a stigma on an individual for being an addict or using, and then again for going to a methadone clinic, and then you put getting pregnant on top of it can be very difficult. So with our patients, we try to first let them know methadone is safe for you while you are pregnant. It's actually safer for them than completely getting off because it has so many risk factors One, it is safer than heroin and other drugs. It is an opiate, like Brian said, it's a full antagonist, but it is safer and has least effects than if the mother was still using heroin or other drugs. When it comes to pregnancy, methadone, there's no better dose, or there's no like set dose to what a woman will be on or reach during pregnancy. It is common for women when they do get pregnant to increase their dose as their pregnancy goes along, like each trimester. Methadone does transfer to the baby while they're pregnant, but when they give birth, it can be affected. Like some do have some withdrawal symptoms. It's never, I don't want to say it's extreme or it's not extreme. It really just depends, especially if the mother is still, excuse me, if the mother is still using. If you put in nicotine, alcohol, that also has effect, especially on birth weight. And so that's another thing that some women and a lot of people are worried about with women being on methadone and pregnant is the after effect. Will they go to withdrawal? Will they die? There are, like I said, different factors that come into play. So you can't really just be afraid of just the methadone. It has a lot of research on it. Buprenorphine is also safe for pregnant women. Subutex, not so much. But methadone and buprenorphine, which we both provide at our clinic, is safe for women. Going back to after a woman give birth, there's not that much long-lasting harm to the child. They normally stay in the hospital for, I think the average was 8.5 days. And that's just an average. A lot of times, like talking about my patients, it's usually like 3 to 5 days. So it's really not that much. They always check to make sure how the baby is doing. You know, they check withdrawal symptoms, how extreme they are, just monitoring. There is a low birth weight that can happen because of being on methadone, but again, it's still safer than if the mother was using heroin or other drugs. After pregnancy, women, they can taper off the methadone once giving birth, or they can continue staying on their methadone, whichever their decision is. It is safe for them to taper after giving birth if they choose. Methadone, it is transferred into the breast milk, but it's research shows that it's too small of an amount to affect or harm the child. So breastfeeding, it's really up to the parent if they want to breastfeed or not. Some doctors say that they recommend it because it helps the baby kind of wean off methadone a little bit, especially if the mother is tapering after they give birth. But it really is up to the mother. And I have seen times where women got scared about breastfeeding because another doctor has told her, oh, that's just going to send them into withdrawal, or it's going to make them sicker. You know, a lot of people, unfortunately, aren't educated just on methadone, but women in recovery. So I've ran into that a couple of times. So we do refer our pregnant patients to, we have the STAR program that's at OU Children's in Oklahoma, excuse me. And it was started by Dr. Stephanie Pierce. She's really great in the program. A lot of my patients, I've only heard good things from it. They're really knowledgeable about women in recovery while they're pregnant. And it's a good place to kind of try to eliminate or lessen the biasness, because so many times, like I said before, there's already a biasness on a person in recovery or an addict being on methadone, going to the doctor, trying to receive care. And so if you throw in a pregnant woman in the mix of it, it can be very difficult and stressful. So the STAR program really has been a really great place for the women to go to feel comfortable and have doctors that know how to handle an infant that is being weaned off of methadone, and if they do have any withdrawals, they know what to take care of and what to look for. So
Well, I think you bring up a good point, Aspen, where when you were talking about kind of the bias and the stigma that's out there, parents helping parents, this is a good platform for us to provide this knowledge and this information, because a lot of the time, oftentimes we hear from people that their family is the most judgmental, and of course this is, they've done some terrible things to their family members, so family members are hurt, but we really do need the family's help in recovery, and especially with pregnant women, because they're going through a lot, and they need that support. And so I think this is really important to know that there is nothing wrong with being on methadone. They are monitored by doctors. They are monitored by nursing staff, by treatment clinicians. This is not what they see on TV. Basically, is the best way to put it. I've watched a few Law and Order episodes where they make MAT look terrible, and this is not what you see to be. This is we are professionals who are here to help, and we want to be able to provide information to everybody, so that way everybody feels comfortable when their child does come up and say, "Hey, I've tried everything else. I don't know what else to do. I've heard of this. What do you think?" We want parents to be able to say, "You know what? I've heard of that too. Let's give it a shot. Let's go be there. We'll be there with you every step of the way, as hard as it might be, because if there's one thing we've learned, it's support is vital to recovery."
Yeah, support is a very big part of recovery, and it makes it so much harder when you don't have the support. And I hear all the time, well, it's just trading one addiction for another addiction. And I understand how people have that perspective, or maybe have that fear of it. But like Brian said, it is just like another medication. I mean, if you look at someone who's taking antidepressants or someone who's taking insulin for their diabetes, it's something that's helping them get better. And you a lot of times you have to weigh out the risks and benefits of things throughout life in general. And so if you look at your loved one and say, okay, he hasn't used heroin in 3 weeks, but he's been on methadone, is his life getting better? Is he holding down a job? Is he attending family dinners? It can really help people get over the cravings, especially, and all the different struggles. Because a lot of times when someone is using and they continue to use to not feel sick from the withdrawals. And so methadone definitely helps that in a big part, so that people can not be, because a lot of times I hear, I just don't want to be sick when I'm at work, or I don't want to be sick at school, or I don't want to be sick here and there. And so it really does help people get off and stay off of opiates, and then let them get their life a little bit under control.
Well, I think it's important to know too, and I don't think we put this out there, that this type of treatment there are requirements to get into this type of treatment. You do have to be over the age of 18, and have at least, I think nationwide now, it's at least a minimum of 1 year of opioid addiction. This is not this is a pretty heavy treatment. This is for people who have really been struggling and really been through it. And so we would hate to get somebody started in this who early intervention might work best for them, because we are dealing with, methadone is a narcotic, and so we are dealing with a pretty serious medication, and so we take it very seriously on making sure in the screening process that people are meeting the criteria in order for admittance into our program.
Yeah.
Brian, I've got a quick question, and really it was a good segue, because you were talking about requirements and some of the structure that you guys use. We had somebody that was curious at Right Way Medical, is participation in a counseling and clinical component mandatory for people to be getting methadone doses and the medication treatment?
Yes. Now it depends on the phase that they're on, and whether or not they're private pay or their insurance. There's certain components that go into insurance that we're not going to go into here.
Sure.
But everybody, for the at least for the first 90 days, people are required to go to weekly counseling sessions or weekly case management sessions. And then if they're providing negative drug screens within that after that first 90 days, and we bump them up in their phases, there's a phase program they go through. So the better they're doing in their recovery, the less counseling they have. That doesn't mean that they can't come see their counselor anytime they want. We do have, open door policies, but it just requirement lessens the better they do in
Yeah. Help me. So I need to preface a lot of my questions with, outside of being familiar with medication assisted treatment, just as a professional in the field, the specifics escape me. I've never been involved in a medication treatment clinic. I've never worked in that type of professional setting. But one of the things that I always think about when I think about medication assisted treatment is partly the idea that there's not any one treatment that's going to be right for everyone. And so there's a lot of people that would say, oh, 12-step programs saved my life and they're fantastic and everyone should do a 12-step program. And then we have clients who are like, I don't like 12-step programs. I've got a aversion towards anything spiritual. I don't want that to be a part of my program. I need something different. And I don't think that there's anything wrong with 12-step programs, but that model is not going to fit everybody. And a total abstinence model might not fit everybody. And this kind of fills the gap between the two. And when I'm explaining harm reduction and medication assisted treatment, I almost compare it to like Weight Watchers, right? Like it's like, hey, yeah, we don't want you to stop taking in calories. We're just going to really monitor those calories to make sure that you can make progress and change while you're still consuming some of them.
Yes.
Right?
Is
that a dumb metaphor?
No, that's actually pretty cool. That's a cool metaphor.
Yeah, I think a lot of people would relate to that. I know I would. The big thing is yes, I mean, you're correct when you say that our goal is to just help you whatever way you see fit. Your recovery is your recovery. We're not there to force you into anything. We're there to just be there for you and be that support, and help you find that path for you. We do have, with making marijuana legal in the state of Oklahoma medically, a lot of people believe that marijuana helps them. So we're not here to tell you, hey, stop smoking marijuana. We're here to tell you, hey, if you're going to do it, get your card, be legal. Don't do anything illegal, but if it's going to help you and you truly believe it's going to help you, then that's okay. You can still come to our clinic. We're not going to kick you out. We're not going to punish you as long as you have a legal prescription for it. And I think that's a lot of the misconception that we get is a lot of people think that, OTPs, our types of treatment, are out there to just kind of lay the hammer down on people. That is not what we're here for. We're here to help people in any way possible. The only time that somebody would get turned away for treatment is if they don't meet that state and federal criteria that they're required to meet. But you're right, there is different ways, and I think that's important for people to recognize, is that recovery is not one size fits all.
Yeah. So one of the things that I think is important to mention is, Oklahoma, we're kind of right in the center of the country, and in lots of different things, we're kind of behind national trends. And talking about harm reduction, and especially medication assisted treatment, is something that coastal,
yes,
especially Northwest and other places, have lots of success. I actually had a really interesting, lengthy conversation with somebody who, I won't mention the name because I haven't asked him if that's okay or not. I don't think he would mind, but he was actually one of the owners and co-founders of one of the biggest national treatment centers that has multiple locations. It's really famous and everybody would recognize, who stepped out of that because he started to get more savvy with harm reduction. And those treatment centers were like, well, you can't still run all of our programs because we're an abstinent-based model. And when we were having that conversation, what he was helping me understand is that a part of their mission is, one, to prevent overdose, which is way too high all across the country.
Yeah.
And if by having places that potentially could help people use safer, that's at least a start towards progress culturally and in communities. But it's a challenging topic. And I wanted to ask you guys, why do you think there's so much stigma related to medication assisted treatment in particular? And have you seen any shift? Brian, you were saying you've been at this for 6 years, and Aspen a handful of years yourself. Have you seen any shifts in that trends toward getting better or getting worse here in the Oklahoma City area?
I've seen a big change in Oklahoma City. I mean, I myself am from Seattle, so I've been around harm reduction and this type of environment for a very long time growing up. But I have seen a big shift in Oklahoma City. I don't really see too many patients anymore, but I used to work with the pregnant patients, and the biggest shift we've seen is with the doctors here in Oklahoma City as far as treating our patients with respect and dignity that they deserve. So that's pretty cool. Aspen works more with the patients than I do now, so I'll kind of let her speak to that a little bit more.
Yeah, I feel like it's kind of a mix. Like, I think it kind of depends on who you talk to, especially, unfortunately, certain age groups of people. Some people just, they don't want to hear facts. They don't want to hear, the research on it. They want to stay with the opinion that methadone is bad, it's addictive. There's all kinds of crazy myths out there. But then, yeah, like regarding the doctors, I feel like there has been a good change in accepting like the women, being in recovery and pregnant, because sometimes, yes, the mother is still using throughout the whole pregnancy. There are times where that happens. And the doctors, a lot of times they'll know, and DHS does have to be called if there is illicit substances in the baby and the mother, of course. But sometimes you get a doctor who they hear you're on methadone and they call DHS immediately. Just even if they're not positive for opiates or cocaine or anything, like they've been sober, they're just on methadone. So, but more so, I feel like people are getting more comfortable of talking about it and accepting it, especially with like family members. I hear from my patients a lot where they say, my family was supportive of me getting treatment. They didn't really understand methadone, but since I have been sober and they've really seen a change in me, like it helps them accept it more and to ask more questions. And how I've had people say, can my mom call you and ask you how methadone works? Or can my wife call you and you explain to her how it works to better understand, and I feel like the more people just ask about it and listen about it, and also successful stories being told, it'll help people be more accepting of it. A lot of times you don't hear the successful stories. You hear, oh, so-and-so overdosed and it was methadone. Okay, well, were they taking anything else? Or, did
on
they
the street?
Yeah, because
were they buying methadone on the street, or was that their prescribed? I mean, it could go 1,000 different ways.
But I mean, they don't go into that, and so that's kind of what we're fighting against. The when it comes to like the biasness is like the popular headlines, but I feel like it has gotten better, even just from when I started, so.
Yeah. Does Right Way Medical exclusively use methadone as their medication, or do you guys offer a variety of different ones?
We offer buprenorphine,
okay,
and Suboxone as well. And there is a difference between buprenorphine and Suboxone. Suboxone is buprenorphine plus naloxone, which is what is used in Narcan to kind of kick the opioids out of the system. And it's not fun if you mix opioids with naloxone and Suboxone. We are a Narcan hub, so we do also offer Narcan kits to people for free. I do want to make sure that that's out there. especially with.
Yeah, so I want to follow that with everyone should have a Narcan kit in their car, in their home, um, as a standard part of a first aid kit. If you're one of those people that's into preparedness, if you're watching, you don't know what Narcan is. It's a chemical that can prevent an opiate overdose if you find somebody that's unconscious. The wonderful thing about it is if they're not having an opiate overdose and you give it to them, it's not going to hurt them, right?
Yeah.
It literally can save lives. Every police officer, every paramedic, every family member should have one, even if you don't have a drug user in your family, because I never know if I'm driving down the street, there's somebody in the parking lot of my building
Yeah.
that's a potential overdose. It's easy to administer. You squirt it right up their nose. I'm sure you guys offer trainings for that. So family members that don't know what that is and don't have them need them.
Yeah, and we provide it to. You don't have to be a patient with our clinic. You don't have to be a friend or a family member of a patient at our clinic. You can walk in and ask us for an Narcan kit, and our nurses will provide you how to use that Narcan kit.
Yeah, that's fantastic. So I do want to share a text message that I got. I'll try. You guys don't know me. I get a little emotional sometimes, and this was an emotional text. So I'm going to try to share this without being too emotional. I had somebody text me privately who lost a son to a fentanyl overdose years ago. Thanked us for getting this material out there and said, I'd much rather my son be alive and doing medication assisted treatment than be gone.
Yeah.
And so for people who are immediately resistant to this information, that's a perspective that's very sobering.
Yeah, and we have seen, I started out doing this in Oklahoma City, and then I went to McAllister for a year with our clinic over there. And when I got over there, I asked people, when I was doing their intakes, what's your drug of choice? And the big thing was pills. By the time I left in that year, heroin had made its way over to McAllister. Now we're seeing an uptick in fentanyl. That's a lot of the intakes that we get. They're taking they tested positive for fentanyl, and this is a drug that not a lot of people know is can possibly be one and done. And so we definitely want to make sure that whatever information people need, they can always contact us. I believe you put our website, our Facebook on your page. So definitely please get in contact with us. I respond pretty quickly. So I definitely want to make sure that people feel safe and comfortable knowing they can come to us, especially with this out there. I mean, there's people are making benzodiazepines or fentanyl look like benzodiazepines out there. And that's even scarier, that you don't even know what you're taking out there. Definitely want to give people help.
I have one other question that I jotted down that I was just curious about. And maybe every clinic's different, and maybe even every clinician within a clinic might have different opinions or thoughts on this. But in general, is there like a mentality of, hey, we're going to do medication assisted treatment, but we only want that to be like pseudo temporary for a certain amount of time, and we would eventually like you to be opiate free? Or do you guys leave that completely up to patient discretion, or do you work with people in a combination of different ways?
Yeah, it at our clinic, it is totally up to the patient. I tell people it's not my job to keep them there, but it's also not my job to let them go and see them a year from now in Walmart and say, think to myself, they look like they need to go back to the clinic. Yeah. So I will be, if somebody wants to taper, and I will be honest with them. That's part of what I need to do in order for them to know what's going on. Obviously, if they're still using illicitly, they probably need to stay with us.
Sure.
But this is where, things like this really help there, because a lot of times people get pressure from their family to leave the clinic. Methadone is this big, bad, scary medication or drug. But we want people to know that it's a medication. It's a drug when it's being used illicitly out there on the streets. It is prescribed by a doctor. You are under a doctor's care. You are under the care of clinicians when you come into our. You know, so that is what the biggest thing that we want people to know is that this is a medication that is going to save your life as long as you use it correctly, and you're not out there with it.
Yeah, excellent. Hey, we don't have any other really questions or comments that have come in so far. So I'll kind of remind people that the contact information for Right Way Medical is in the comments section of this video on Facebook. So if you're watching on YouTube, go to Parents Helping Parents Facebook page. I don't think I gave that information out at the beginning. I think I skipped something. I was too excited to get to the meat. At Parents Helping Parents Inc. is the Facebook page. parentshelpingparents.info is our website. Check both of those places out to get connected to where our local chapters are and the other things that we might have going on. Actually, go to Facebook and website because we're partnering with the Department of Mental Health and Substance Abuse Services. We're partnering with Stonegate Center in Texas to provide, I think, a 10-part webinar series. I think it's 10 parts. It might be 6 or 8 parts. That's why you need to go to Facebook to get the exact details. That are specific self-care resources for caregivers. So it's a webinar series about how parents and family members can be monitoring their own self-care and taking care of themselves while they're also trying to deal with somebody else's substance use. So check those out. Those are starting this month, I believe next Tuesday. But for more information, check us out on the web. So Aspen, Brian, any kind of maybe last comments or just, oh, you know what? There is a last comment because I can't believe I almost forgot this. I ask all of my guests the same question kind of as we're beginning to wrap up. And that is, and Aspen, I'm sorry, but ladies first.
Okay, get it over with.
Yeah. So it's real simple. It's if you had like 60 seconds to give a message to either somebody that was struggling with substance use that's out there watching, or a family member that has somebody struggling, what would that simple 60-second message be to those people?
Like a loaded question. I would say, just support your loved one as much as you can, seeking different treatment, like you said, not everything's going to work for everyone. So just don't knock it until you try it, and if you don't like it, you don't have to stay. Like Brian said, we don't make people stay. We don't kick them out. Someone who is struggling with addiction, it doesn't matter if it's your 15th, umpteenth time of getting treatment. Eventually, it'll stick if you let it stick. If you really want to do it, you want to be serious and take your sobriety serious. You got to do it for you most of the time. You can do it and be made to do it by other people, but the most important thing is doing it for yourself, and don't give up on yourself.
Excellent. Brian, same question.
I would echo a lot of what has been said. The big thing is just, I know it's hard, but recovery is possible, right? We're everybody is redeemable. We all deserve a second, third, fourth, fifth chance. And as a parent, just maintain. I'm a parent myself, of teenagers and younger, but maintain your boundaries, but also be there to support. Because it is possible. You don't just need to cut people off. A lot of people have that mindset of it. They either need to cut them off, or they're too enmeshed and they're too, and they're too entangled in their lives. There is a happy medium. Find that happy medium. Provide them the support they need. Take care of yourselves and just be there for each other.
Yeah, excellent. Hey, thank you guys for doing this for us tonight. It really has been informative. We've had some great comments, and we've had several people that just say, thank you, this information's valuable. We're glad we're sharing it. Thank you guys for what you do in the recovery community locally, and on a bigger level. And thank you for kind of filling that gap. That's still a little bit of a weird place in Oklahoma, right? And I just appreciate you guys' time, because you could be doing lots of things on a Monday night, but you carved some time out for this, so I really do appreciate it.
Definitely. Thank you for having us on.
Yeah, thank you.
Yeah, you're welcome. Hopefully I'll run into you guys sometime. It's been weird the last kind of couple years with COVID and stuff, there just
Yeah.
hasn't been as many like connecting events, and people haven't been out and about as much. But I'd love to grab coffee with you guys and talk more about this stuff. And I actually need to come by and get some Narcan. I was preaching to the choir. I don't have any in my Jeep right now. So
Yep. We also do have our OKC West location as well.
okay. So you guys have South, which is where at on the south side?
We're down near the old Crossroads Mall.
Okay.
Yeah.
And then the west side is over on 29th Street, kind of over by the airport.
Okay. Yeah. Excellent. So awesome. Well, thank you guys so much. Families, feel free to connect if you've got further questions about medication assisted treatment. I'm sure anybody at Right Way would love to speak with you. And thanks for joining us. We'll see you guys in 2 more weeks for the next Parents Helping Parents Live. Thanks, everybody.
All right. Thanks,
Thank
Jared.
you.